Hello, dear friends. Today we will talk about keratomas, also known as seborrheic keratosis. This is the development of the skin's corneal layer, the cells that are called keratinocytes. One cell gives rise to the formation that looks like this. It is very important to notice that there is a very long history of human genetics. It is a long history of human genetics that we can be able to understand. The greatest number of human genes is in the human body. This is a very significant number, and it is the greatest number of genes that we can see you next time. It is believed that somewhere in the elderly, almost 88% of people have at least one keratoma. Why do keratomas develop? Well, the explanation is this. There is one single cell, keratinocyte, which suddenly begins to multiply intensively and gives offspring to other similar cells. These cells have a violated property and grow into such keratomas. And why does this cell multiply? Because it has mutations. Genes in which receptors encode to certain proteins. Receptor mutations to the growth factor of fibroblasts 3 and mutations of phosphatidylinositol 3 kinase. These are two such key factors, AKT kinase. This AKT kinase, when it is activated, it slows down the death of the cell. That is, it does not allow cells enter apoptosis. Apoptosis is a programmable cell death. If the cell becomes immortal, then it exists for as long as you want. It loses the properties of the functional cell and acquires the look that we are all used to. Or rather, many of these cells with lost properties to apoptosis. In fact, keratomas do not cause any harm to health. What can be done to avoid this? You can pinch them, press them, scratch them, they can inflame, bleed, and so on. But this does not pose any mortal threats. The only thing that can be done is, a person who is used to having a lot of keratin on his body, he can really miss some skin tumors or melanoma. If he is used not to pay attention to what is happening to him. Well, and so, in principle, no problems. But people still want to know how to get rid of this disease. And of course, it would be great if there was such a drug, which would block the mechanism of keratoma development itself. As you already know, the mechanism of development is the activation of the ferment, AKT kinase, and indeed at present actively conducting research and development of the drug, which could block this ferment, and as a result of which all keratins would die by themselves, and these drugs are inhibitors. The case is only for local treatment. For local treatment, both chemical drugs and surgical methods of treatment can be used. Among chemical drugs, 40% peroxide solution is approved in the United States, which is called Escada. Also used to treat keratoma solution of trichloroacetic acid up to 100% solution. Well, by the way, I met on the internet 40% solution of trichloroacetic acid is sold. It has a necrotizing effect up to almost all epidermis it burns. And it can take, of course, keratoma, but this method of influence of trifluoroacetic acid can end with abundant rupturing, and it should be considered as a variety of surgical treatment. Also, in one study, the effectiveness of a cream called tazarotene was shown. Tazarotene is a representative of the third generation of retinoids, which are usually used for acne treatment. And here is the 1% cream, in 7 cases out of 15, gave a decrease in the size of keratins. It can smear the keratins by itself, and they will fall off, which does not require a doctor's visit. Well, if the keratins are large, of course, they reach a centimeter in size, then you need to contact, not what you need, but if they do not suit you, you can live with them. Of course, you need to consult a doctor, and you can apply various surgical methods, starting from a laser, from the influence of liquid nitrogen, ending with radio wave destruction. That is, in principle, all these methods are available. The only thing is that if there is a lot of keratin, then, accordingly, they take a lot of time to remove them all. Therefore, if you are bothered or occur in those places, for example, on the face or on those areas of the skin that are injured, well, Here you probably need to contact the doctor as soon as possible in order to eliminate this formation, because it is clear that if the keratoma grows large somewhere under the eye, it will be more difficult to remove it than if it is 1 millimeter. Well, that's the situation with keratomas for today. It's unpleasant, but there is nothing to be afraid of. We are waiting for a drug that will block AKT and akinase, and then, in theory, we will all be happy. Goodbye.